A lot of people have even poor health-seeking behaviors, so just going to the hospital is just hard for them. But when they hear that the hospital can come to you, it's just like all those apps that bring your food to your home, that bring your products to your home.
White coat hypertension, where you are normal at home, but in the hospital you are very hypertensive.
But right now we are experiencing it, people wanting convenience, people wanting to cut the cost of going to hospital. To be honest, your time is very expensive when you start queuing in a hospital and you're sick, and you just probably just require something for your flu. So that cuts down all that, and having the home care being done is quite cost effective.
This, home care, it's been in existence, but it's not structured. Doctors just do concierge medicine where they have clients, they have people who know their doctors, and they just call them, bring them to their home. So that's why it's good for platforms like Zuri Health. They already have qualified professionals, qualified doctors, qualified nurses, qualified, laboratories, lab attendants who would come to your home and, do those things for you.
Welcome to the Med Squad podcast, where we acknowledge that the world has indeed changed. But there was a change that happened a few years ago that changed it in an irreversible way. Or is it reversible? We're talking about critical care, but there's an aspect of it which we'll get to in just a bit. Right now, I have the Med Squad with me. My name is Yafesi Musoke, and I have
Dr. Kelechi, Okoro, also known as the Healthertainer, and I'm a loud advocate for health equity, especially online,
Especially online?
Yes.
Oh, okay. All right.
My name is Bansi, and I'm a home care nurse.
Anthony Ndegwa, a general medical practitioner, passionate about cardiovascular disease and chronic illnesses.
Okay. So now, when we talk about critical care, of course, critical care implies that it's for the very sick. But now, what we're talking about today is how home became the new hospital. So, doctors have been critiquing people like me and the rest of us, our health-seeking behavior. We're not going to the hospital, we're not going to the hospital. So what is it that happened to make home become the new hospital? And what are the benefits of having home as a hospital?
2 words, access and accessibility, right? A lot of people have even poor health-seeking behaviors, so just going to the hospital is just hard for them. But when they hear that the hospital can come to you, it's just like Uber or Jumia or, all those, I'm mentioning brands, all those brands all those apps that bring your food to your home, that bring your products to your home. That's just what this particular thing is solving, access and accessibility. When it comes to access, especially for areas, let's go now down to the grassroots, for people who do not have access to good roads, infrastructure, your house is far from the hospital, or for the critically ill, or for the disabled. Imagine having to transport a disabled person with the flight, with public transportation, or whatever it is. Isn't it just easier to bring the hospital down to them? Okay. And also, I think, yes, so just makes everything easier. Critically ill, the disabled, those who have the money, okay, you just want to stay in the comfort of your home and get access to healthcare. And also preference, right? Sometimes the waiting time in the hospital is not encouraging at all. There are some illnesses that you have, transporting yourself all the way to the hospital, waiting for your card, waiting for your records to be drawn, waiting for a doctor to get to you. It's all, just stressful. But when the hospital is coming to you, then it's just convenient, right?
Yes. So, but then that makes the hospitals of different standards depending on where you live and what resources you have. That's
a factor. However, as she said, it boils down to a matter of convenience and avoiding certain risks associated with hospital visits. And in general, home care or probably is more suited for people with chronic conditions that you don't want to expose them to the hospital now and then. Even the presence of being in a hospital and you can see other people suffering, sometimes it can even aggravate some of these things. We have white coat hypertension, where you are normal at home, but in the hospital you are very hypertensive. So anxiety and all those kind of things. Think of mental health in a setting of a home, you're more comfortable. So it does not replace a hospital, it just gives you an alternative to offer better services in a more conducive environment and conduce and issues of convenience, as we've said.
Yeah. Is home care, is it widespread enough here? Let's start with here.
Not yet. I think people are now adopting it for, people actually think it's just like doing home for the old, which is done in first world countries. But right now we are experiencing it, people wanting convenience, people wanting to cut the cost of going to hospital. To be honest, your time is very expensive when you start queuing in a hospital and you're sick, and you just probably just require something for your flu. So that cuts down all that, and having the home care being done is quite cost effective in terms of time, in terms of money, in terms of convenience.
And let me also add, it also improves productivity.
Yeah.
The time you used to go all the way to the hospital, just stay in your house, cut down that time, and use it to something else. I mean, you might be sick, but you still have some mental work to do. You still have, to attend to your personal and your family needs in the house.
Yeah.
So yes, it's solving a lot of problems, not just, medically.
So let's talk about then availability, because if I'm here, it's not that when I don't ask for these services, these people are idle. So how are we able to spread those resources? Are there enough people to cater, if it actually starts to become more widespread? Are there enough people to cater to the needs or the demand?
Yes, I feel there are, just that we have not gotten a way to centralize all these medical people in one bracket. Because I feel like in every household, even if it's an apartment, you'll not lack a medical practitioner, one or two. So assumingly you had a platform where you can access them just like a normal database. Can you order for a doctor? Can you order for a nurse? Can you order for a lab person to come and collect your sample? Yeah. So I think it's a question of how knowledgeable are the people out there about these services and the convenience they get.
Okay.
Yes, on the same, and to just probably give examples like Zuri Health, you have such a platform. So this is incorporating the traditional hospital and having that branch of telemedicine where you can order these things virtually, the same way you order your food stuff or probably other services remotely. You still can do the same. So in Zuri Health, you're able to order for medication. It will be delivered right at your doorstep. You can order for hospital visit where you have nurses, nutritionists, doctors, and all these specialized services. They come at you. Think about x-rays and other, for example, portable imaging and screening modalities that we have, ultrasound. Think of ANC. You can do a full ANC at home. They come take your blood samples, and it's something that is being done. However, the issue of the knowledge of the end user is very important. But you see the modern world, even the older in our society, they still know how to press one or two buttons or two clicks or a mouse and to get a doctor.
And also the home being the new hospital helps in sensitive cases like sexual and reproductive health. People don't want people to know that they're ordering sexual health products. They don't want their neighbors or their friends to know that they want to have sexual wellness tests, STDs tests, and fertility tests. So with the Zuri Health platform, they have packages for sexual wellness. So you don't need to go somewhere. You might get to the lab and it's your girlfriend or your girlfriend's mother who's the lab scientist on call. Okay, so this helps a lot. So that's why it's good for platforms like Zuri Health. They already have qualified professionals, qualified doctors, qualified nurses, qualified laboratories, lab attendants who would come to your home and do those things for you. As against this home care, it's been in existence, but it's not structured. Doctors just do concierge medicine where they have clients, they have people who know their doctors, and they just call them, bring them to their home. So, but what this does is that the patient is not sure of the quality of care they are getting, or even the qualification, or if this person is actually, a qualified doctor whose licenses are up to date. So, what platforms like Zuri Health is solving is making sure that the SOPs are, perfect.
Okay.
Yes.
Standard operating procedure.
Allow me to also add something. Apart from the acute illnesses that Baby Zuri Health is solving, we have a branch that speaks about palliative care, where we actually we're not looking at to improving. We're just trying to offer that patient quality care at the point where they're also exiting life, which is very true. So that patient is better fit at home very close to their relatives, very close to the people who matter most to them at that time. So home care is very, very diverse. I think it's a whole new podcast.
It's a whole other podcast on its own.
Exactly. And writing on what she said, nosocomial infections that you went to the hospital to treat an infection or a disease, and you're living with a brand new one.
Yeah.
Not just you, your visitors, your friends, your loved ones. So, I mean, home care just eliminates that totally.
Oh,
Yes.
you can have an outbreak in your neighborhood of monkeypox. Well, right now we're talking about hospital at home. How it's growing, yes, that is obvious. We've already talked about it. It's starting to grow. However, there are guidelines that we want to look at when we come back right here on the Med Squad podcast.
Hey there! Welcome to Zuri Health HQ, where Africa's finest medical minds meet modern care. I'm Yafesi, your host on the Med Squad.
Care is personal. It's not just diagnosis, it's direction. From a cough to managing chronic illness, we listen and we lead.
Every symptom has a story. We listen, explain, and act together.
Nutrition is not just about food. It's fuel, it's healing, it's prevention. We help you eat with purpose, for energy, for recovery, and for lifelong health.
We are not just lab coats, we are detectives, and your blood speaks when we translate.
Your mental health is not a luxury. It's your health, period. Whether it's trauma, depression, anxiety, or even wanting to speak to someone, we are here for you.
At Zuri Health, collaboration is our strongest prescription. We connect expertise across Africa to deliver care that is smart, affordable, and people first.
This is the Med Squad. Real conversations, real health, real people. From your inbox to your bedside, we're with you.
Welcome back to the Med Squad podcast. My name is Yafesi Musoke, and I have with me Bansi. I got Dr. Kelechi. I got Dr. Anthony. Yes, and we're talking about, well, critical care, but also with special focus on hospital at home. In fact, it's called HAH in some places. I don't know if that acronym has caught on, but we know maybe COVID had something to do with this growth, because there was a time people were avoiding hospitals altogether because they didn't want to get COVID. Hospitals were overwhelmed. But now when it comes to home care, are there guidelines for home care models? Because if your house is dirty and I come and treat you for one thing, can I leave you in that squalor that you've chosen to live in because you don't clean up after yourself? Trash is everywhere. Or are there guidelines for either types of accommodation? Could be diet, are there guidelines to assist in making it effective?
Yes. It's hospital at home again. So just as we had spoken, we said the nurse and educator, and we come from different backgrounds. So you expect every family has its own dynamic and even things. And even as a problem, some families actually have hygiene problems. So those are conversations that you have at that point, and you're like, if you want us to stop having these wounds, then you need to clean up a bit of your surfaces and things like that. We also have a set of people in home care called caregivers, who actually handle hygiene at their level, and they're able to even create an environment that is safe. In terms of guidelines, we home care is still I think people do it different. People try to emulate what a hospital will look like. So the medical equipment we put at home is hospital beds. We put ventilators. We put oxygen cylinders at home. We put concentrators. Whatever you'll have gotten in a hospital is the same thing that is being done at home. So, the doctors, the nurses will still be there with you. Yeah.
How is that bill footed? If you're coming to install ventilators and other things, monitoring equipment in my house, because there's an electricity bill, that is mine. But who is bringing the equipment? Is it covered under insurance, or are there guidelines for this where it's allowed to go?
So in the Kenyan setting, so think of hospital at home from the basic point of view. You're talking of you having a child at home and you think they are not doing well. You want a doctor to come and do a consultation. It's basic. They do a consultation. They do some tests if they have to. And then a prescription is written and the medication is brought and you are good, right? Now, think of a chronic patient who is now a critical kind of patient. A patient, for example, who who is on cancer management or palliation or such kind of a thing. You're looking to give them the services they can afford. And that is with respect to even the insurance. The insurances that are not going to allow you to do such kind of things at home. And that's why she said it's something in progress. It's work in progress. We are still trying to learn on how we can do it best, because we know the benefits of doing so for specific patients. And for the general public, if we could have people get their treatment at home, I think it could be better. The bigger question I'd want to ask, do you think your house is dirtier than any hospital?
Some parts are cleaner, some parts are not.
I don't think a house should be dirtier than a hospital,
Yes.
because
Yeah.
a
It's very
hospital
dirty.
has infectious,
Potential,
infectious. So your home, you could have infectious, but not the strong bugs, not the chronic ones, the big ones that they don't listen to medication. So you're talking of the big of the biggest
cockroaches.
Yes,
Those ones.
but at homes you're dealing with the things that you can manage.
Yes.
Okay.
And then riding on what he said, he was talking about affordability, and you talked about you have to, like, a patient that needs intensive care, are you going to come and install a complete ICU unit in the hospital? Are you going to bring a PET scan? No, you're not going to bring a PET scan to the hospital, except maybe, there's some in Nigeria, there's some people that can afford that. But what we're saying is that it's a process, right? There's some you do in your house, and at some point you'd have to be transported to get some of those things. But it's not a one size fits all. Okay? You still have to go to an extent. There's some things you cannot do a surgery in your house. So after all that care, after all the home, but it's just making it easier, making access better, making just making a lot of things easier. The things you could have gotten in your house without going to the hospital, you do those. Then the ones you have to go all the way to, you do that.
Okay. So what if the patient in general already was antisocial and doesn't like visitors, and it's the family that has insisted that you have home care, or they have no pets, the cat just comes and changes something that was plugged into you, and then now the story has changed. So what happens? Is it the patient who makes the choice and says, I agree to this, or is it in the best interest because the priority is the patient's health?
Home care is very private. You choose your doctor, you choose your nurse, because these are people you live with. And sometimes the very difficult choices is that the family are the ones getting to choose what you need, because at that point they become the next of kin, especially depending on how critical the patient is. Most of the time, especially because now we're talking about critical patients, they're not at the point where they can make their own decision, but the family does. But the advantage is you get to choose who you want and who you want to stay with.
You can decide, this doctor, I don't like his face, I don't want this doctor anymore, bring another one. But in the clinic, whoever your file gets to is who's going to see you.
Wow.
So you have the autonomy of choice.
Yes, on the same, that is an issue of consent. Even in the clinic settings, if you don't trust the doctor in front of you, you have a right as a patient to refuse treatment, the same way the doctor might think you're too aggressive to manage, and they have a right to not offer you services. So in the home setting, again, the consent is there, but it depends on your health status. If you are incapacitated to a point that you are unable to make decisions of your own, then the next of kin is allowed to make the decision. So talking of the other aspect of that cat that unplugs something is an issue of safety, right? So again, it depends with the kind of services you're offered. Today we know that a glucometer or probably a blood pressure machine is no longer a hospital equipment. Homes have them because that is where we are headed. Earlier, you could only get it in one person in the whole village. So again, it's situational. It is not like you can say now there is safety issue. Because even in the hospital, there are safety issues. Patients falls and things going, electricity can go off and that concentrator goes off and all those kind of things. So I believe it is a case by case, and safety is something that the health professionals and the family in general have to be in check always, everywhere.
Is there a practical example you can think of where hospital at home? Yes. What do we call it? Do we call it home care? Hospital at home? In home care? In care, home, what
you can even call it in your language if you like. So whatever
it's home-based.
Home-based care. All right. Is there a practical example you can think of where that actually worked better? When the patient was sent home after well, no progress in the hospital. Yeah, it's actually well.
So there's something we call quality of life. Regardless of what management you give, you must weigh with what are the detrimental effects of the management you're giving to the patient. You see, you can lengthen somebody's life by 1 year, but they are brain dead.
Yeah.
Okay? So there's no quality of life there. So home care offers that most other than any other modality. Where, if for example, I am ill, I am better off suffering with my son at home, looking at my TV, other than being in the hospital and there's a child being injected there and they are crying. And you see the environment can be therapeutic at some point. So an example is I've seen a lot of patients on oncology or cancer care. They will do well. They will, regardless of what you're giving them, they have better quality of life. Regardless of how long they will live, I am more concerned with having a better life than a longer life that is not good for you and also your family members.
Yes. And then sometimes imagine you're in a ward and every single day someone dies.
Yeah.
It works, it does negative things to your psyche, right? You're thinking, I'm going next. So you're not seeing other people suffering. Remember, a lot of people are empaths. And when they see suffering, they feel suffering. Yeah. So home care really helps. You're with your loved ones. You're in an environment that is conducive for you, that you are used to. However, if you know that your home is toxic, please just go to the hospital.
It's good.
It's actually better to be, because there's sometimes that, imagine, we're in an African setting, we know, your uncle wants to kill you, your mother doesn't like your progress, your auntie is a witch or something like that. So imagine that person is a caregiver.
Yes.
And then one day, person removes your the charger for your what they call it, what they call it again? Because they don't remove. No, you have to plug something that it uses electricity, right?
Yes.
And then the person removes it to plug this charger. Okay, so those are the things you still have to consider. Is your home conducive enough?
Consider your enemies.
Yeah, we're in Africa.
Let me add something. When you're talking about palliative care, there are two sides of a coin. Apart from the patient side, then the family side. They actually get to debrief better when the patient dies, because they'll have seen how the patient is actually deteriorating. They're like, actually, this patient is more sicker, or dad is more sicker today. And then actually dad is progressive, not in terms of curative, but you're actually seeing the patient deteriorating. So the family becomes they become at peace, seeing how actually we've done everything for dad, but now dad is not in the best position. The family lets go very fast actually, and they heal better.
As against when they're in the hospital, they say the hospital killed the hospital, because in the hospital everybody is just going don't even know what's happening. They just come in with one injection, go out to the injection, the next thing the patient is dead. But the doctors, the nurses, the medical team have been doing their best, but you're not able to appreciate it because you're not part of the care.
That's actually a very good point. And when we come back on the Med Squad podcast, we'll be talking about some of these myths and challenging them when it comes to home-based care. Hospital at home. It's the Med Squad podcast. We'll get the terminology with this because it's something pretty new in some areas. We'll be back. Welcome back. It's the Med Squad podcast. And as we talk about home care, home-based care, hospital at home, and with regard to critical care, well, we want to look at some of the biggest challenges to home-based care, whatever we may want to call it. What are some of the biggest challenges that are faced by, even if the doctor or the hospital or the health system, whatever it is you recommend, home-based care for this? What are the biggest challenges?
Okay, so we mentioned some earlier. Electricity, some treatments need electricity, some treatments need advanced, equipment, some treatment needs advanced, skills. You can't bring all of those all the time to the home. So those are some of the challenges. There are some medications that have to be properly, they just need, some form of advanced, technology. And then you can't just bring that all the time to the home. Those are one of the things. And then another problem is getting, I mentioned that it's skilled care to the home. Yes, I think those are some of the challenges that the patient might get. Yes, and then also home care interference by family. Yes, we mentioned that interference.
Yeah.
Yes, interference. You might be doing something right, and then a family member is not following through with the process, because remember it's home care, but you're not going to be there 24/7 sometimes.
Yes.
You can give instructions. You can, sometimes you're there. You're not there 24/7 sometimes, but some procedures, relationship procedures, like like a patient who has been immobilized for a long time, turn the patient this way, put powder under the legs so that they don't get sores and all of that. Yeah, there's some caregivers who are supposed to do that, but the essence of home care is to also educate the family on how to do some of these things themselves and to also support. So you're doing your own and then you leave. The next day you come there and everywhere is moist and they've done something wrong. Yes. And then also, so when they're in the hospital, their diets can, so for patients who have conditions that they have to be on strict diet.
Yes.
Okay. So you're in the hospital, the medical doctor is working with a nutritionist. Okay. And then usually there's a cafeteria or a kitchen that caters to the specific diet of some of these critical patients. Some they ask them to bring food from home, but sometimes there's some hospitals, right, that cater to the feeding when it's on strict diet. But at home, you see your niece eating one steak and cheeseburger and all of that.
Yeah.
And you know how emotional you can be. Give me small now, and then just okay. A little will hurt.
Smelling of
Exactly. A little will hurt, and then you are influenced by your family that loves you. They're not doing it to hurt you, but they just think, oh, let me just give them a little, and then you cause another problem. So these are just some of the ones I'll mention, and I'll let others mention some.
Actually, I could talk about some myths that people may have had. Home-based care means that they have given up. It's a death sentence. Is that a myth, or is that some people just believe if you're not going to the hospital means you can't be helped?
No, it's
that's a misconception. Yeah.
Okay. And what about the ones who say the logistics will be too much, so why bother? You have to keep coming.
Two-way. No. Actually, sometimes it's actually they are set their area that time, and you don't even feel like they're not going and coming every single time, but probably set up there or area that time. So there are challenges. The challenges of payment and versus what you'll have received in a hospital. A home care it makes more cost effectiveness in terms of money or payments.
Yeah, but lunch is provided now to the staff.
Yes, lunch is provided, but not in every circumstance.
Yeah.
Some families prefer not to actually interact and treat them like professions and give them lunch breaks and go.
Oh.
Yeah.
So they go and come back.
Yeah, so there are challenges, I think, when you're talking about logistics is payment. Currently, the government insurance, which you call as SHA, chief or whatever.
SHA, chief.
Yeah, that one. Does not pay for home care.
It doesn't.
Yes. And even the other private insurance only gives a window of 30 days. So most of the time, patients actually have to pay for themselves in cash. And that's not very reachable for everyone. So you might have the best insurance in the world, but you cannot pay for your home care when life gets there.
So that's what's discouraging for some people. So the question would be can it actually become a permanent or even sustainable solution for healthcare?
Yes, it should actually.
It can be.
Yeah.
Yes, it can be.
Is that going to be a wider conversation about the economy and
you see, everything starts with stepping stones.
Yes.
Yeah.
So we are headed there. However, you see today, for example, you're at home and you needed to do the services offered at the hospital are probably the same services offered at home. The issue is how we get there and the cost of all those things. That is where the insurance says now how you get there is your own problem.
Yeah.
Because the insurance is not even sure that you walked into that hospital to get that treatment that you got. So if the doctor came at home and did your ultrasound, the insurance can still pay for the ultrasound because that is the actual service you are offered, regardless of where it was offered. Okay, because it does not pay the virtue of you being in the hospital. It is a service offered.
Yes.
Okay. However, the challenge is we must agree that from a monetary point of view, home care is more expensive, and that way because it's an issue of convenience. If you want to be special, then you must pay the cost. But overall, in terms of your healthcare, it is better compared to a hospital visit in certain conditions, because other conditions better to be in the hospital because of the risks involved. The other challenge, other than cost, the other challenge is safety, as we talked about earlier. With some conditions, you need to be closer to a nursing station, right? So think of that home care who is not about them setting up, is coming and going, reviewing after now and then, and such kind of a thing. You find if the patient maybe gets exacerbated or there's a worsening of the condition, then the time frame, and in Africa, the emergency response is still again growing. So those are some of the challenges I think home care experiences. Again, there's fights from the tradition.
Yes.
I beg to differ. I beg to differ because you're talking about it being more expensive, and I'm doing my calculations. If I see you right now, I apart from paying for the space, I'll pay for the oxygen. Triple as much. I think a bill minimum, even on I'm looking mission, mission or government hospitals, which are the cheapest, you'll pay with 100,000 a day.
So I get the point. However,
I'm at home and I'm having my concentrator, and all I do is switch on and receive the same oxygen that I'll be paying for in a hospital. So I don't think it's more expensive.
And then in comparison to every day.
Yeah.
It's something you can use to buy oxygen, later.
So you see, that is from one aspect.
Yeah.
You see, if you look at it critically in a holistic aspect, if you want a pediatrician to come and see your child at home, you will pay for that convenience.
Yes, sure.
That's not an issue.
Okay, so how about if the hospital is very far, and then you have to pay? We forget transportation. That it costs to get to the hospital. So we also have to factor in, it's not just the cost of consultation and the medication, the cost of transportation. Some people have to fly.
Yeah, it's true.
Go see some pediatrician. But you're right, she's right, I'm right.
For example, the setting in Zuri, the consultation for a home visit is not close to the consultation for a physical visit in the hospital. So the issue of you going to the hospital, the money you will pay as your own transport, it has not been discarded. Because the doctor will come home. So you will pay in there for them to
come home. Yes. Okay, yeah, true. And then talking about it, it still boils down to the fact that not all interventions, not all treatments can be done at home. No matter how home care becomes, a household, it doesn't. No matter how how wide reach it gets, you can never take away the hospital from patient care. It doesn't replace patient care in some ways, but if you have a high level surgery you have to get to the hospital.
Hey, I think we can give concluding remarks because there are many, because it's still growing and it's something that can keep going and going and going. And I've mentioned how Zuri Health offers these actually offers you in guidance. So is there a way that we can direct? So we can get more information about home-based care from the Zuri Health app, or are we directing them to a website, or do they just do their own research?
Of course, yes. Zuri, yes. So first of all, Zuri Health has a lot to offer when it comes to home health, continuous care program. Ordering medications from the app. Ordering from pharmacies, ordering a lab test, and also for those who have chronic illnesses, like those who have high blood pressure, they have steady medications, they're always on medications. You have medication refill.
Yes.
You don't need to go to the hospital for medication refill. And remember, the people who have chronic illnesses and have medications for like high blood pressure medications, they need to remember that it gets to a point where you need to review your medication, that you're put on a polytherapy. Okay, that you have 3 medications 5 months ago. If you're doing well, it should be reduced. If you're on steroids, it should be tapered down. So you don't even need to get to the hospital to get that review. You can do it on the app. You can get a doctor to do it for you. Okay, yes. So this is how you can use this Zuri Health to really encourage or, just get home care at a very, very subsidized, it's subsidized because affordable rate. Yes, so that's how apps like Zuri Health can help. But also, we're not just putting it on Zuri Health. Independently, there are some things that you can do to improve home-based care.
Yes.
Okay. We should have smart homes. It's like I'm reaching, but we have homes now that you can talk to Siri, you can talk to Alexa to put on the lights, to open the fridge, to make a meal.
Yes.
We can have smart homes where they can have detectors. Okay, Zuri also has an app or a service where you can check your blood pressure, or you can even do a mental health check on your phone. So taking it away from Zuri Health again, smart homes where you can have a toilet that when you urinate, it can detect that, oh, your urine is too dark, it's too, yes, I'm reaching. But if we have homes that are smart enough to close the blinds, open the door, and also we can have things like, abroad they have it where people who are epileptic, people who are prone to fall, they have animals that can support them. Yes, so it's not technology, but it's also it's something you're doing for yourself. So aside what apps are giving us individually, we have a role to play. So whilst the realtors and all the tech people are making smart homes that are for enjoyment, let's remember that health is also enjoyment. So these detectors can help. They can really help. Yes.
Okay. So instead of Alexa and Siri, we can now have Nyakinywa and
Vera.
Yes, so whoever it may be. But we're talking about home-based care. You can follow us at the Med Squad Pod. There's plenty more that you probably want to know about that you can inbox us about and tell us any topic that you'd like us to address, or any aspect of this particular topic that you want addressed. Maybe it's personal to you because your home is indeed personal. But this is the Med Squad podcast, where we take the personal and make it public, and also focus on your safety and your health. That's our priority. We'll see you on the next episode.